Well, most of the people we see here with ear pain, ear discharge, dizziness, uh, hearing loss, most of the time they don't know whether it's coming from the outer ear or the middle ear or inner ear. So then we got to make a diagnosis by asking more questions. If it's just an outer ear, most of the time it's usually fungal infections or swimmer's ears, very common, which can be treated by medications. And the other causes are for in pediatric populations, usually chronic ear disease. They will have a lot of ear infections treated by the primary doctors that come in here to get resolved. We advocate PE tubes, which is the ventilating tubes to help that ear infections to settle down. The other causes people do come in, they don't even have a drum. They come back here hearing loss and you look at it, they don't have eardrum. So then the question comes for us is it'll help us to graft the eardrum. And those will improve hearing, and then if there are older populations, helps them to wear hearing aid as well. Sometimes you will see hearing loss secondary to bone fixations, like otosclerosis. It's a unique condition where stapes completely get fixed. We may have to put a prosthesis or piston to help hearing. In addition, we also do bone anchoring hearing aids, where people cannot do a proper ear surgery, so we can implant the bone hearing aids that will help the hearing as well. Those are the main 80% of our ear disease that we see. Very small percentage, you'll see tumors in the ear, very rare, but you see glomus tumors, acoustic tumors also. Those are diagnosed with CAT scan and other imaging studies to further evaluate those patients and further manage. A lot of patients that I see have TMJ. They grind their teeth and the ear hurts and they're all referred pain. Or even they can have a tumor or infection in the tonsils, the ear can hurt. Those are things that I see most of the time when the people come just for ear pain and everything looks normal. Your eardrum looks normal, there's no discharge, and they're not dizzy. Those are the ones I think you got to figure out where the pain's coming from. Come in, we'll examine the patient, we'll see where the trouble is, we will navigate their ear pains, and we will help them so that they don't suffer from ear pains.